this Horizon Government Affairs presentation of the 2020 elections and their implications on healthcare policy. It is November after the elections, and we still don't have 100% certainty of who the next president is. And but we do have a lot of questions and a lot of answers to what we think is going to happen both this year and next, and would like to present those thoughts to you from our team of experts. And so without further ado, why don't we go ahead and get right into it. So first of all, just a little bit about Horizon Government Affairs. We are a team of bipartisan professionals that came together about 14 years ago. The company started to advance healthcare policies that would make healthcare work better. And since that time, we've been able to enact 40 different public laws. We've made dozens of regulatory changes. We've built 3 solid coalition networks that engage with about 200 different organizations across the healthcare spectrum and are very effective at delivering a multi-stakeholder approach to our advocacy goals. So we're proud of our team. You're going to be hearing from a lot of folks that you're seeing in this picture on the call today. So let's go to the next slide. Thank you for joining. And I think we're here to talk about the agenda, healthcare and healthcare coverage and prescription drugs. I mean, come on, man, what more can you ask for? I think maybe "come on, man" will be the phrase of the early 2020s. But we're going to break this webinar down into a couple of key buckets. First, we're going to talk a little bit about the election and what happened. I don't want to get into too much depth, but we will get into some of the analysis because, again, the presidency has not been certified yet. But, you know, Congress and the states, we know the dynamics and want to get into that. And then we'll talk a little bit about what we expect in the immediate future on the timeline, lame duck, and into 2021, and some of the policies and issues that we've been most focused on in this Congress and probably in the next year. And then we'll talk about the key congressional committees and key players in a Biden administration. From a cabinet level, we've been pulling together and tracking all the different potential candidates for a Biden administration, and we'll get into that. And then we'll finally leave the agenda with an outlook for the states and what happened at the state level with our VP of State Affairs, JP Weisky. So let's go to the next slide and talk a little bit about our top lines here. I think that, you know, first and foremost, you know, we should be celebrating that so many people turned out and voted. At the end of the day, we had close to 150 million votes. That was the highest voter turnout in absolute numbers in history. In terms of the percentage of the population, the highest since for the past 40 years. And I think in the end, it came down to coronavirus versus the economy, turnout and likability. And right now, it looks like Vice President Biden will become the next president, pending some legal challenges, which the Trump campaign continues to mount. And we're seeing an aggressive push today, in fact, to challenge votes in Georgia, recount likely there, Pennsylvania, Wisconsin, certainly, Michigan, probably not, but Arizona and Nevada, all on the list for the legal challenges. But I think it's important to note that despite those challenges and whatever happens with them, we've got an aggressive timeline between now and December 8th, which is the safe harbor for electors, and then the votes on December 14th, and ultimately coming into next year with the certification of the results and how this all plays out with the inauguration of a new president on January 20th, or an extension of the Trump term. The biggest takeaway for me was that there was no blue wave, right? There was, Biden might have won the White House, but Republicans are favored to hold the Senate at this point in time. They certainly expanded the number of seats that they hold in the House. And so I think that there was, you know, some difference in how people were splitting their votes or voting for different people. At the end of the day, though, Biden simply had more votes, and the Electoral College math didn't work out this time for Trump in terms of the states that he was able to carry. What it also, the other big thing for me is that we've got a divided country and a divided government. I think a lot of the big ticket items, if the Dems swept and there was a blue wave, a lot of those big ticket items are probably on hold for now. The Green New Deal or green economy, as Biden likes to talk about, the public option or Medicare buy-in, Medicare for all, tax reform and increased taxes on corporations and individuals. I think all of those are probably on hold with a very narrow majority in the House and probably in the Senate for the Republicans. Incrementalism is much more likely, and I think that the challenge for Biden really is balancing multiple competing constituencies between progressives on the left and some of the conservatives who are very upset about not picking up seats in this election in the House and actually losing seats in the House for areas that Trump carried in 2016. Biden is going to have to work hard to build some coalitions and work with Republicans to get a lot done. And that's going to be a real challenge. It's not insurmountable, but to the extent that the country is kind of divided into camps, means that he's going to have to work super hard to make it successful in the first 2 years, certainly. So as a result, I think in the meantime, absent any kind of big deals with Congress or even incremental ones, we're going to see a lot more action on the executive branch side. And Trump, I think, for a lot of the Trump moves by executive order, by regulation, by funding, by contracting, will probably be undone by the new Biden team. And I think that the opportunities really to influence the regulatory process is something that we're looking at hard, because we think that a lot of things can be done day one, like Paris Climate Accord, some of the executive orders on drug pricing, some of the regulations on Affordable Care Act and other issues. And at the end of the day, there's a lot of debate around exit polling, and there's different exit polls that you can look at, that will say, what actually happened in the election, what do voters really care about? Some say the economy really hurt Trump. Some said coronavirus. Some say the economy helped Trump. At the end of the day, I think that there are a lot of people who are very upset about the handling of coronavirus and some of the challenges that we see on the public health side, whether it's CDC or HHS or pandemic task force information coming out about the coronavirus. And that was a challenge. And I think a lot of people made up their mind, at least the exit polls show that folks made up their mind around coronavirus, and that probably hurt Trump. So those are some top lines. I do think that we'll get into some of the more details here if you want to go to the next slide and figure out how this all played out on the presidential side. So let's dig into some of the numbers here. Obviously, right now this is a picture of the Electoral College. 270 needed to claim victory. Folks calling 279 at least at this point for Biden. Some folks have even more for Biden. As I mentioned, lots of legal challenges that are going to be filed. I think, for me, the big thing here is that a lot of the calls before the election were wrong, in some cases dramatically wrong. Trump, I think, outperformed where he was in 2016 and expectations and the polling averages. And so I think he did have increased turnout among the base, and he made significant inroads, I think, with both Blacks and Hispanics, particularly in Texas and Florida, which we'll see in a second. I think people liked Biden. They found him as honest and compassionate and trustworthy. I think people agreed with Trump on the issues. That's what the polling showed. And they believe that he's a strong leader that stands up for what he believes. So it was a very tight, if you go to the next slide, a very tight election that really, while turnout was high, it was won by the narrowest of margins on the popular vote side. I mean, look at some of these, Pennsylvania, maybe up to almost 7 million votes cast. That comes down to 34,000. Wisconsin, very narrow. Florida, not so much. Texas, not so much. But these are small numbers in comparison to total votes cast. And, I think that, I'm just going to move my presentation there. I think, it represents the fact that we are very divided as a country in the two parties in our political process. And so, as I mentioned before, Biden, Trump, are going to have to work to bring people together very hard, or we'll continue to see this polarizing trend. You go to the next slide. In terms of the race dynamics, I think that, basically how I think about it is that Trump got his votes mostly from older white voters, except white college educated women. He did better with blacks, Latinos, Asians than he did in 2016. Trump took all the Christian groups. So if you look at, the geographic breakout, largely the rural and small town voters, Midwest coalition hung together, except for the Wisconsin, Michigan part of the coalition, but they were also middle income. Conversely, Biden, when I think about that, he really took the younger, more racially diverse, urban, suburban voters who were educated, took the college educated white women vote from Trump. Some people are calling this the revenge of the suburbs on the Trump vote. Biden won both the low income and the high income groups. He also took majority votes amongst Jewish and Muslim voters. Jewish with very high vote total of 68% about, and that was surprising considering Trump's moves, especially with respect to moving the capital of Jerusalem and some other issues. Women voted more than men, and more women voted for Biden. I think that the only surprising thing in the party demographics is that people, while they mostly voted for party line candidates, 8% of Biden's votes were from Republicans who were largely dissatisfied with Trump, maybe the never Trumpers. Independents also broke for Biden, 51 to 37%. But if you look at the issues, I think coronavirus was a top voter issue. Again, there are different exit polls on this, but so the AP Vote Smart database, about 41% said it was their top issue, followed by the economy and then healthcare, gaining less than 5%. Some of the more headline grabbing issues, racism, law enforcement, climate change. These are narrow voters, narrow issue voters who vote exclusively on those issues. But 41% ranked coronavirus as the top issue, and of those, 73% voted for Biden. So it really broke Biden's way on the coronavirus issue, and there's lots of reasons for that. 81% really looked at the economy as excellent or good, and they voted for Trump. So Trump was winning, for people who had a more rosy outlook. And I think everyone knows about that Gallup poll. About 56% of people who said they were better off now than they were 4 years ago would fit into this category. But then 50% of all voters in the AP database said that coronavirus was not under control. And they dramatically, 83 to 15% went for Biden. So it's, again, we think that the coronavirus, the handling of the coronavirus issue really hurt Trump. And I think it's interesting, a couple of days after the election, Pfizer announcement comes out, and all of a sudden people have a much better outlook on what's happening with coronavirus. But I wanted to make sure that we got our Obamacare question in here. I think country is still split about 50-50 on Obamacare, whether to expand it or change it or repeal parts of it. And obviously the Supreme Court arguing today on the Obamacare case in Texas v. Azar, and that decision we'll get to in a little bit. So go to the next slide.
Before we go on, I see someone has raised their hand. If you have a question, just use you can either use the chat function or the Q&A box at the bottom, and then I will ask Joel the questions in between slides.
All right, go to the next one. So what changed from 2016? I love this graphic. It's something New York Times produces. If you go to their website live, each one of these arrows, red arrows, show increased Republican support and votes, and the blue arrows indicate Democrat support. The size of the arrow indicates the degree of support. So if you look down there in South Florida, all the way down there, that's the Cuban American bump that Trump got, about 32% increase in voters on the Hispanic community. Also down there along the Texas border, big bump up in Hispanic support for Trump. If you're looking at Utah, Idaho, these are probably expats from California. But then if you look at, across that Rust Belt, where some of the change happened um, from Oklahoma, Kansas, Colorado, Nebraska, South Dakota, Minnesota, Wisconsin, and Michigan, really a change in favor of the Democrats, as well as the coasts. So the coasts are not surprising. It is surprising in this Midwest here, where Biden picked up some of his support, and then again, in Ohio and Arkansas, Missouri, Iowa, where Republicans really turned out in force. That had an impact on the Senate races, which we'll get to in a minute. But really, I think that the change here was that there were just 5 million more votes for Biden, and that added up to Electoral College success, and the math worked in his favor, I think. And obviously, again, want to do all the caveats. The race hasn't been called yet. There's legal challenges. Things on the ground could change, but all indicators are that Biden will be in the White House come January 20th. So wanted to talk a little bit about the Biden cabinet and the advisors. If you go to the next slide. So, just looking at some of the key health departments and who might join a Biden administration, you've got HHS, you've got Labor, Treasury, VA, and some of the key advisors for Chief of Staff and Pandemic Task Force. HGA has actually assembled a database of likely candidates in each position, even beyond healthcare, defense, education, housing, et cetera, that we'll be sending to clients post-webinar. But for HHS, I want to go through these a little bit. Those first three, HHS, Labor, Treasury, those are the tri-departments or tri-agencies, where Trump has used those three departments to issue rules around ACA coverage, like short-term plans, association health plans, individual coverage, HRAs, treatment of certain workers, et cetera, that have an impact on health issues. And I think, what we're going to see kind of first day is a review, or already under review, all of the rules that the Trump administration put in place and how they might need to be modified or repealed. In HHS, we're hearing two primary names, Dr. Mandy Cohen at the bottom there, and Governor Lujan Grisham from New Mexico, who's on the transition team. She's a close advisor. She's the first Hispanic governor in New Mexico, and the first she managed the New Mexico task force in response to COVID and did a pretty good job there. We're putting her as odds-on favorite on HHS. For Labor, we've got Harvard professor Sharon Black on top there, former DOL professor, and then Julie Su, who's the current labor secretary in California, is some of the odds-on favorites. I know Andy Levin, who's a current member of Congress from Michigan, is in the mix too. People are also talking Bernie Sanders, Tim Perez and others from DNC. I think, people talk about senators are in play here for the cabinet. I'm not sure that strategy makes sense with a very narrowly divided Senate. If it comes down to one vote, one senator leaving in a state where a governor couldn't appoint a new senator would make zero sense. So we're downplaying the Senate, role here in the cabinet process at this point. That could obviously change. In Treasury, we've got a number of names. I think we could see the first woman Treasury Department secretary in history. A couple of key former Federal Reserve officials there in the VA. Mayor Pete, whose last name I really have a hard time pronouncing, is under consideration for both VA and UN ambassador. He's also on the transition team as an advisor. And then Tammy Duckworth, who's in the wheelchair there at the bottom, current U.S. Senator, really an impressive individual, lost her legs in combat, and is under consideration for a number of posts, VA, DOD, and some others. But I think a very dynamic individual. I think what we'll hear this week is an announcement for key advisors. We've already heard the Pandemic Task Force, and you see Dr. Murthy down there at the bottom there for one of the co-chairs of the Pandemic Response Task Force. We believe that's going to be the key first issue for the Biden administration. to manage. But clearly, Biden's relying on an inner circle of longtime veterans from both the Obama administration and his years in both the White House and the Senate. We think it's unlikely that the Senate will hold up a lot of these nominees. We think that even though ideologically people have gone further that way, that there's a deference from Mitch McConnell and others to let the president choose his advisors. I do think the liberal groups are going to be policing the Biden picks, and already we've seen some of the Hispanic community demanding 20% of all cabinet picks must be Hispanic. Anyway, so we think that he's already said, Biden has said that the cabinet needs to look like the country, and I think we're definitely seeing more female candidates, more racially diverse candidates as well. On the chief of staff pick, those two pictures on the right there, Ron Klan and Jeff Zients, I think are key candidates. Both have been with Biden for a very long time. Both have impressive credentials. Both have worked in the White House, and I think both would be pretty solid candidates. So the last thing I'd mention on some sub-agencies, CMS, Kavita Patel, I think is a solid candidate from Brookings who's in the mix, and a couple of others, Rebecca Gee and Sherry Gleed from New York School of Public Health. She's a former ASPE administrator and has helped with the pull the Biden agenda together for the campaign. So these are, again, stuff that we've compiled in a database that we're managing. We'll send out after the webinar to HGA clients. If you're not an HGA client, be in touch and we'll see what we can do. You go to the next slide. So top issues, again, pandemic response, that includes state and local relief. I think it also includes a fiscal stimulus, the economy, unemployment, payments to individuals, minimum wage and gig workers and how they're treated, I think is in that mix. And then strengthening the ACA and the public option, we think is, there's some regulatory steps that they can take, but mostly working with Congress there. And it's unclear how much is going to be able to be passed. We'll get to that in a little bit. Addressing healthcare costs, we think that the Trump administration drug executive orders are probably going to get rescinded, but that the Biden administration is thinking about what can they do kind of across the board with their tools to put pressure on the drug industry, hospitals and doctors through the regulatory process and other tools at their disposal. And then, kind of some of the non-health issues, obviously a big deal. We also think that privacy rewrite might be in the mix here. We saw some initial trial balloons floated this year from different groups who are close to the Biden people. And obviously the HIPAA rule is outdated and in need of a facelift, but also a regulatory monster that can be changed through regulatory changes. But first and foremost, that pandemic response, I think we all know the public health system is, really needs an update too. It's very old and frayed and needs some tender, loving care. So you go to the next slide. So what do we think the Biden next steps, where could they go? There's 4 primary buckets. The one that we don't have on here is executive orders. I think that's a given. An executive order is kind of like a memo from the CEO. It says like, this is how I want the policy done, and it gives directions in these 4 different buckets. But I think, first and foremost, there's going to be this focus on COVID and stimulus, and anything they can do in their regulatory toolbox, they're going to do to help strengthen the pandemic response. A lot of that, frankly, will be building off what Trump has already done and teed up in many instances. But then we think they'll get to some other issues, primarily coverage and costs, drug pricing. And this is just in the health world. We didn't get into defense and immigration and some of these other issues. But in terms of changing the regulations, we really do think that the regular process of health plan regulations in Part D, for example, and C, payment rules in Part A and B, how public health rules are governed in terms of how you're reporting things and into the CDC, et cetera. those are done through regulatory changes or contracting requirements. And really, we think that that's where the administration is going to go first. In the demonstration and pilot program space, though, we do think that the administration is going to aggressively use Medicaid waivers and as a tool to both change state-based programs and expand on them. I think even governors have, Republican governors have found the allure of Medicaid funding intoxicating. And so we could see the holdout states that haven't yet expanded their Medicaid programs using the Biden administration levers to really get into different types of programs and funding mechanisms. I would say there are some hangovers from the Trump administration that would play into next year. One that we pay a lot of attention to is value-based payment reform, particularly for drugs and Medicaid best price and AMP and the reporting requirements through the Medicaid program. We would expect that the Biden administration would continue those and continue to pursue really a value-based agenda that tries to link payment to better outcomes and in terms of cost and quality and patient satisfaction. So that we expect to continue to go through. And the primary mechanism for that would be through the Centers for Medicare and Medicaid Innovation. And getting a little bit more muscular on the demonstration programs that come through there. There's independent demo authority in the Medicare program, and I think there's plenty of authority in the public health space through HRSA and AHRQ and CDC and NIH and all the different public health agencies to drive changes through on-the-ground funding and other mechanisms. So we think it's going to be fairly aggressive, but again, keep in mind the kind of hierarchy here is kind of all COVID first, and then as the year goes on, these different changes, we are expecting aggressive action on drug pricing and on ACA rewrites. JP, anything I missed here that you want to jump in on, or Brett?
So the one thing I would jump on, Joel, is I think states are facing like a dual crunch on Medicaid. I think they're seeing significantly expanded enrollment in Medicaid as we're talking right now as a result of the pandemic. On the flip side, that means higher costs for them across the Medicaid budget. The NAMD, National Association of Medicaid Directors, this morning was talking about that as an issue, the massive amount of enrollment, the changes, the expenses that are sort of attaching to COVID testing and COVID. And so we'll get into the states in a minute, but the budget pressures there are going to be interesting to see, coupled with the problems of coverage that folks are going to be seeing in the markets and in the ACA markets going forward.
And the only thing, excuse me, the only thing I would add, it's not really healthcare related, but it does go to, the fact that we expect a lot more executive action than pushing legislation because of the potentially very closely divided Senate. Is that I think, a day one activity is that climate change and rejoining the Paris Agreement. And I think we'll see more things like that go through to undo a lot of the executive orders and things that have rolled out of the White House, excuse me. And that's just the first, I think, day one activity. That's a great example of that.
Yep. It is get ready for the whipsaw or the roller coaster, however you think of it. All right, let's get into well, just to build one last thing on Brett's point. I think that from the administration standpoint, we've got a lot of expertise in how these regulations are shaped, how the rules come out, and how these things get pushed through the system. So if you're interested in that, I think that that's an area that's really going to be aggressively used, perhaps more aggressively used over the next 2 years than through the legislative process. But let's talk a little bit about Congress, my old stomping ground, Brett, Sloan, others, Jen. So first and foremost, the Senate, I think that folks know we're right now at even. We got 4 races to call. McSally and Gardner there on the left lost. Tuberville won. Alabama flipping a D seat to an R seat. Arizona and Colorado were losses for the GOP. Still haven't called Alaska, North Carolina, and Georgia has 2 runoffs. But the expectation is that over the next month and change, there's going to be an intense national focus on Georgia with Get Out the Vote, with funding, with ads, with all kinds of stuff to try and affect that race, because Alaska and North Carolina are expected at this point to go Republican. So if it's even 50-50, obviously a Vice President Harris would break the tie, and committee chairs would be Democrat, and Democrats would technically, would control the Senate leadership process. So some surprises here, though. Iowa, Joni Ernst won by 6 points. Susan Collins up in Maine won by 7 points. Montana, Steve Daines won by 10 points. Lots of strangeness in the numbers that the pollsters, I feel like, need to answer for. But we are expecting probably at this point likely Republican Senate, and Mitch McConnell to be the majority leader. In the House, the surprise here was that there was an expectation based on some of the polling and some of the aggressiveness, if you want to go to the next slide, that Democrats would actually pick up seats. And right now it's +5 net gain for Republicans. They flipped 8 seats, but Democrats flipped 3. There's about 21 outstanding races in New York and elsewhere where it's too close to call, or there are recounts being held, actually. But the interesting thing was the folks who lost were in the districts largely where Trump had carried in 2016. So in 2018, those districts flipped, a few of them, and then they came back. Kind of a surprise on the Minnesota race with Colin Peterson, who's been there like forever, and lost his seat. But that's a very conservative district as well in Minnesota. So let's get into some that's the baseline, right? The Democrats have a more narrow House, but they're still in control. Nancy Pelosi's Speaker. The leadership elections are coming up next week, I believe. Committee chairs will be decided probably in December. Senate leadership elections, I think, were today. No real surprises, but the Senate is still outstanding, obviously, but we expect it to go Republican. So if you go to we want to talk a little bit about what's on the agenda, and obviously through the congressional committees, and then getting into a little bit of issue crystal balling. I'll turn it over to Brett here to talk about the Senate.
Sure. So not a lot of change in Senate committees. Again, this is, like Joel said, we expect Republicans to retain the Senate. But the pictures on this slide really won't change if Democrats do end up winning one or both of those races in Georgia. So, just starting at the top, Finance Committee, Chuck Grassley is timed out from his chairmanship. Mike Crapo will take over, and that's been expected for some time. Big proponent of Medicare Advantage. But, again, because the numbers in the Senate really won't change that much, we don't see a lot of progress on big issues. But the biggest things facing them, obviously, all of the Medicare extenders expire December 11th with the government funding date. There's been a lot of talk from both sides on passing maternal health bill. We've seen one come out of the House, and the Senate's been trying to see if they could do that. Unclear, obviously, if that'll go this year or they'll pick that up next year. Obviously, the DISH cuts that also expire on December 11th. Drug pricing is always an issue. They've been a huge priority for Chairman Grassley. That won't go away, especially with the Biden administration. And then, this is the theme throughout, other than appropriations, is that the major committees in the Senate have to have hearings and vote and approve cabinet members. So most notably for finance, they'll have a hearing and then vote out HHS secretary and the CMS administrator. Moving on to the help committee, where I lived for several years. Chairman Alexander is retiring at the end of this year. So next in line is Richard Burr. There's a question there because he has been the chairman of the Select Intelligence Committee. He's on hiatus from that position right now because of an investigation, but it's expected that he would be offered to take that back up. It's unlikely, or I should say the rules state that he could not chair both help and intel. So there's this lingering question that no one knows the answer to other than Richard Burr of whether he will take help or he will keep intel. I think there's a small possibility he could ask for a waiver from leadership to chair both, but I think that's very, very unlikely. And next in line is Rand Paul to chair help, which I think, is very different from Richard Burr or Lamar Alexander leading a committee that, has jurisdiction over public health, FDA, other things like that. However, if you're Mitch McConnell and you've got a narrow margin in the Senate majority with the Democratic House and the Democratic White House, Rand Paul might be a great tool to have on a committee like health whose topics are lean heavily Democratic. Patty Murray will remain ranking member. Again, if Democrats take the Senate, she'll be the chair. And the issues will sort of continue. Surprise billing's been one of their biggest pushes, the Lower Healthcare Costs Act. Some iteration of that will likely be reintroduced next year if it doesn't go this year. The biggest thing on the docket for help is the FDA user fee agreements. This is more than half of the funding for the Food and Drug Administration comes through user fees, and those have to be passed by next September. So that's a must-pass bill. They will have a hearing at help on the HHS secretary, but they did not vote on the HHS secretary, but it's just more process for getting cabinet members through. But they do have hearings and vote on the FDA commissioner, the labor secretary, and the education secretary. So a lot of cabinet members moving through that committee next year. And again, it would be interesting to see how that plays out if Rand Paul ends up chairing it. Finally, appropriations. Really no change here. You'll have Richard Shelby and Patrick Leahy in chair and ranker positions. That's been the way in the 116th Congress. Notably, those two have a great working relationship. They're able to cut deals. Obviously, appropriations bills don't really happen on time and haven't for quite some time in the Senate. But we expect their good relationship to continue. And the two subcommittees that are most important for healthcare, Labor H and Ag FDA, will have the same chair and rankers. Roy Blunt from Missouri, Labor H, will be the likely chair. Excuse me, Patty Murray, Labor H for the Democrats. You have John Hoeven doing Ag FDA for Republicans, and Jeff Merkley doing Ag FDA for Democrats. So those won't change. The most likely things that they'll be doing is, COVID. These guys will hear all of the cabinet secretaries once they're through and the Biden administration has a budget out. These guys will scrutinize it and propose, the actual funding levels. So it'll be interesting. And these are all the key players we think in healthcare for the next couple of years. And, notably, there's a lot of overlap. You have Merkley and Wyden, both from Oregon, chairing key committees and subcommittees. Patty Murray continues to have two very important seats, including a leadership position. So not a lot of change in the Senate. The Senate's, a slow animal. But it'll be interesting to see, particularly in the help committee, who ends up chairing that and what direction they take. So thanks. Next slide.
Let me just jump in there. So the appropriation bills released today, I think 12 of them, Leahy, Shelby basically said they're in 90% agreement. So to Brett's point about how good they get along, but Brett also, just a note here, Brett just joined us not too long ago, was one of the senior staffers at the Help Committee for a number of years and really gets the dynamics of the Senate and how it operates. So any questions about the Senate, Brett is your person to go to.
And before we go on, we had a question relevant Can Brett or Joel explain what happens to the committees if there's a tie in the Senate and the role of the vice president?
Yeah, Joel, correct me if I'm wrong, but if the Senate is tied, the vice president is actually the secretary of the Senate, I think is the title.
President.
Yeah, president of the Senate. Sorry. So Kamala Harris would be the president of the Senate, and it would be a Democratic majority, and Democrats would have the chairs. One thing and if there was ever a split in a vote, the vice president would have to come over. We've seen that a lot with Mike Pence having to vote for judges and things like that. But I think Kamala would just have to live in the Senate full time. One thing to note, this chairmanship question, obviously it makes a big difference, between a Burr or a Paul. But it's unlikely that we're going to know this. Sometimes leadership will very quickly after an election say who they're going to point to. But if you're Chuck Schumer, you may not want to actually get the resolution drafted to pass as soon as the 117th Congress comes in, because the difference in budget allocations between a majority and a minority is very significant. On Help Committee, for example, it's about $1 million difference in how much those staffs get. So, I've been trying to get a lot of intel on what's going to happen, who's going to go where, but it's just all in limbo right now in the Senate because of those Georgia races.
Yeah, and the only other thing I would add is that, if the vice president, as the president of the Senate, is breaking the ties, you get to vote on your if you're a Republican, your leadership package, your rules package fails, the Democrat one wins. And so once that wins, then you allocate who's on the committees and who the leaders of the committees are. The thing I would say about this is that, so say that happens, right? That would assume that the Georgia races go D, or one of the, Alaska or North Carolina goes D, and the Georgia races are split. So it's a 50-50 split. The last time we saw that with Jim Jeffords switched parties back in the 2000s. And, it's not, we could see examples of where there's a current sitting senator who might be considering switching parties from D to R, who could be, kind of confound the math here. So I think this is a process that's going to play itself out. We can speculate all day long, but I think, at this point, we're pretty confident, or we're leaning that the Senate would be Republican, and that it would work out this way. So hopefully that answered the question. On the House side, just very quickly on the Appropriations Committee, Neil Lowy is retiring. We've got a kind of a three-way Captor, DeLauro, Wasserman, Schultz race. I think DeLauro and Wasserman Schultz are the key players there. Kay Granger would continue to be the ranking member. I think Wasserman Schultz has been very aggressive in putting out an agenda for what the Appropriations Committee could do, and it's much more muscular than it was in the past. Would include things like eliminating the Hyde Amendment, restoring earmarks, and really promoting equity in federal spending, or kind of set asides for certain program goals like racial equity and gender equality and things like that. I think immediately they've got to work on the CR omnibus that government funding runs out on December 11th, as Brett described, and then really, I think there's a desire from Democrats and Republicans to go back to normal business or order, and try and get a better cadence for the appropriations bills to get done on time, so that we don't have to be 2 months into the new fiscal year before we see the Senate appropriation bills. On the Budget Committee, I think first and foremost, we've got Womack stepping down on the Republican side, and that's triggering a race between Bill Johnson and Jason Smith. Very similar folks, but Jason Smith is current House leadership on the Republican side. He's not seeking re-election for leadership, so that might give him a leg up. I think this is important because if there's been no budget resolution for 2 years, and that means there's no chance to get reconciliation in an evenly divided Senate if there's any kind of a legislative deal around a bigger plate of issues, it would probably have to be done through reconciliation. So it's a process we're watching very closely to see if maybe something bigger than just some nibbling around the edges happens. The other thing I would say is that the debt limit is probably going to get hit next year. We're looking at probably late spring, early summer, and then extraordinary measures into the fall. If you don't know, we're at more than 100% of our economy at the debt limit. It's largely because of COVID and shutting down the economy. So it's an issue that a lot of people are worried about. Lots of dynamics on the changing dynamics on the Senate side about how people are voting on new spending, and a desire to really get the debt and the deficit under control. On education and labor, a lot of focus on some of the labor and education issues. For healthcare, we're really watching surprise billing and transparency. If surprise billing doesn't go in the lame duck, it's a Lamar Alexander high priority. Education and labor would have a big say over that. They also govern the ERISA program, and there you've got Virginia Fox and Bobby Scott really trying to figure out how to move that forward. If you go to the next slide, with energy and commerce, Frank Pallone would remain the chair. We've got a race between Kathy McMorris Rogers and Mike Burgess. Burgess very much, Kathy McMorris Rogers has been in leadership for a number of years for the Republicans. Mike Burgess, really a doctor from Texas, an expert on healthcare issues. Chairman Pallone has already said that he's going to make strengthening the Affordable Care Act a key issue for him. Also lowering drug pricing and increasing funding and reforms for public health and federal research programs. They also have jurisdiction, like the Health Committee, over the FDA reauthorization process. That's a must-pass bill coming up that they're going to have to spend some time and energy on. That's a bipartisan effort. And then, they've got control over the environment agenda there, advancing, kind of Green New Deal type efforts. And Pallone has already talked about climate legislation that achieves 100% clean economy or green economy by 2050. That would be very controversial. Probably one of those bills on the progressive left side of the spectrum that would go over to the Senate to die, but something that I think the chairman thinks is important to work on. And then lastly, this is related to the Judiciary Committee agenda, but protecting consumer data privacy. All three of the leaders here have been working on consumer data privacy issues, also health privacy issues, and I think that that's going to be an issue for the committee that the committee will consider in 2021. If Burgess does get elevated to ranking member, we would expect Brett Guthrie to step into the health subcommittee slot from Kentucky, and Anna Eshoo from the Bay Area there is really probably will continue to be the chair of the health subcommittee, and is a much more moderate voice there on the committee. On the judiciary side, we add it here because of the big tech issues in Section 230 that became very prominent during the election. To the extent that tech is becoming such an integrated part of healthcare, we think it has major implications. The chair, David Cicilline, and ranking member Jim Jordan probably won't change, but the staff on the Judiciary Committee has done a fantastic job of kind of laying out the issues. We expect that to get teed up. Antitrust and Section 230 legislation to get teed up in 2021 and possibly move. On oversight, really, it's all about coronavirus and drug pricing. Carolyn Maloney fended off an attack. I think that she's will be reelected. She took over after the death of the previous chair, and then James Comer is the ranking member. And they were pretty aggressive on some drug pricing oversight hearings last year, including calling up some of the CEOs of the major drug companies. So we're expecting a continuation of that, as that is a populist, is the hearing that doesn't stop giving. And then Ways and Means, Richie Neal and as the chairman, and Kevin Brady is the ranking member. There is a pension bill that has strong bipartisan support. I think Richie Neal is looking at some tax issues and trying to scale back the Trump tax agenda. In terms of the health agenda, though, it's really about strengthening the ACA. They have jurisdiction over all the tax premium credits and things that make the ACA affordable for people. So they're really looking at how to improve the ACA. And then in Medicare, the hospital and transparency type agenda is very much top of mind. And then, I would just throw as an aside there, the Ways and Means Committee was kind of the skunk at the picnic in terms of surprise billing last year. They've got kind of a more of an arbitrated type approach versus, kind of more of a competitive or rate setting approach as the other committees. Unclear if that will continue to be the case next year, but we expect surprise billing to be on the agenda for 2021. So having said all that, like, what's the big picture here? And what are some of these issues that we can, start drilling into and talking about? Well, I think, pandemic relief, including stimulus, so those first two ones there, we consider those high success, high likelihood of being enacted, possibly even in the lame duck. I think the Biden people, though, are looking at, even if they get a lame duck COVID package, for pursuing one in early next year as well, an additional bill. There's economic factors and public health factors at play. There's bipartisan support now. McConnell came out saying we need a COVID bill. I think that the package might get a little smaller because of yesterday's announcement from Pfizer and a lower unemployment rate. But we're looking at either lame duck or early next year or both. For prescription drug pricing, definitely an issue politically that works for members. I think they're going to keep pushing and banging on it. It's politically attractive. It's hard to see how anything big happens. I think the Senator Grassley continues to push to try and get some of the provisions of his bill that passed the committee into a lame duck package. We're hearing, in particular, Brett talked about the maternal health bill. We're hearing AMP cap. We're hearing real-time benefit tools, maybe some Medicaid changes, on the that were included in the committee passed bill. So definitely something that we're keeping an eye on. Into next year, though, I think the international reference pricing continues to be an issue, whether it's MFN, as Trump has supported, or the international price index that Pelosi has supported. We would expect an HR 3 bill to come through the House again. I think there was very low pain for members who voted for that, and they pointed to it in election after election as something that they've been doing to help lower drug prices. So we would expect that to come through the House again. Not a great chance to pass in the Senate, but we could see a way to get to a compromise over some smaller issues. JP, do you want to talk a little bit about the expansion of health coverage?
Yeah, I think it's going to be an interesting discussion. I think some of this is going to deal with what happens at the Supreme Court when you're looking at the arguments today and what happens with the ACA. Now, of course, that's primarily focused on the individual market. I think those who are CHC members and HBI members understand that when we've seen a lot of this, there's been an erosion of some employer coverage, and supporting employer coverage is going to continue to be an issue and something to take a look at. I think when you're looking at coverage expansion, there were discussions about Medicare buy-ins. Medicare Advantage is certainly a program that continues. There was a question in the chat about this. I think that's something that continues to be supported. You may recall a number of years ago, they tried to cut the rates of Medicare Advantage. It's still continued at the same rates. I expect that to continue under the Biden administration, that program is popular. But there'll be some efforts to expand through Medicaid. I think there'll be some efforts to look at a Medicare buy-in. But I think functionally, I think that where the rubber meets the road, I think for us, is having a broader discussion about how we move from talking about the ACA and getting into health reform part 2, dealing with the actual underlying costs, figuring that out. I'd highlight the work that we've done in North Dakota. We can get folks a copy of that report. Jeff and I, along with the North Dakota, sort of led that effort and put together a program. Jen Hammer was involved as well. talking about hospital costs as a piece of this, which is important and varies significantly state by state. But I think there's some efforts to talk about health reform and to find some ways to sort of make coverage more affordable for employers, because that's the underpinning of our system. 90+% of coverage, private coverage, is coming through employers.
And to just build off that, with the budget deficit and debt, I think, the primary, strengthening the ACA and then public option Medicare buy-in from the Biden administration really fits into the budget deficit and debt. If they were going to try to expand health coverage, they would have to get probably protection through reconciliation. The public buy-in model probably saves money in the CBO world, and that would that would fit into a budget deficit debt scenario. But I think that again, this is the divided government. Highly difficult to see how, or it's difficult to see how it's easy to see how a public option or Medicare buy-in gets through a Republican-led Senate with all the tools at the disposal to slow that down.
And to your point, to just dovetail off of that, Joel, I think what you see is in the polling, public option, and we talked about this before along the polling that we did. Public option is universally popular, right? You look at the numbers and everybody loves public option until you start talking about what a public option actually means and you get into the details. So I think people like the generic idea, but when you get to the push and the shove of it, it gets a little bit more complicated. And when you get into the nuance, some of that support evaporates.
Yeah, and I think there's going to be a big push, I think, from some of the outside groups to, support a public option or Medicare for all type buy-in. I think one of the strategies that'll be used is to kind of undercut employer coverage and say, why is there this tax exclusion or tax benefit for employer coverage? And doesn't that lead to waste and stuff like that? I mean, I think that the challenge here is, employer coverage has gotten attacked from the left and the right. And really it's where the vast majority of people get their coverage. They like it, 85, 90% support. It's challenged, the cost challenges are real. And I think that that's where rubber's going to hit the road. I know JP, HBI, and CHC, two of our coalitions, are going to be focused pretty heavily on employer coverage and efforts to drive down costs in that market. Mm-hmm. As we mentioned, FDA reauthorization must pass. These are expiring. The fees fund the FDA and approval of new and innovative products for both drug, biologic, but also on the device side. And biosimilars. And, I think that comes together. It's typically bipartisan. It's always, angst and difficult and it's hard, but at the end of the day, it always comes together in a bipartisan way. And then we talked already about appropriations, big tech, tax reform. This is kind of similar dynamic as health coverage. I think there's some big, desire to undo the tax cuts from Trump and, increase taxes on corporations and individuals. Don't see how that gets through the Senate. Brett, anything to add to that?
Yeah, one thing I want to make sure we mention, and this is totally wild card, but it's out there and it's 2020, right? So we gotta consider everything. Is if we don't think it's likely that Democrats take the Senate. We think McConnell will stay majority leader, but if Democrats take the Senate, there is the possibility of them waiving the filibuster. Now Trump was screaming for that the last 4 years, and Republicans didn't do it. For all votes, but there is some history here. Harry Reid waived the filibuster for district court judges in 2013. Mitch McConnell did it for the Supreme Court, and a lot of people upset on both sides. I think just being a constructionist, wanting government to function, it's not good if the minority loses all power, no matter who's in the minority. So if for some reason, somehow Democrats take the Senate and then waive the filibuster for all laws, so there's only a 50 vote threshold, even if they have it split even and Vice President Harris comes over for that 51, a lot of the colors on these bills and Biden priorities change. Again, total wild card. I think it's very unlikely that happens. But again, 2020, I wanted to mention it just in case.
2020. All right, you want to go to the next slide? Let's talk a little bit about timeline. Senate, like I said, has already reconvened. House reconvenes. We'll have some leadership decisions, even though some of the House Senate races might be outstanding still at that point. We'll come back in the week of the 30th. Go to the next slide. And that CR expiration extenders expiring on the 11th will really drive either another short-term fix or, kind of a bigger omnibus bill, which could include COVID, could include health extenders, tax extenders, maybe the National Defense Bill, WRDA, and others. But really the dates related to the election, December 8th is the Electoral College safe harbor deadline. And then the next week is the Electoral College delegates when they actually get together and vote. At the end of it, that will, in our system, help determine who actually is the president. And the thinking is, we saw in the Florida Bush v. Gore situation, the Supreme Court made the decision, the safe harbor deadline is 35 days out from the election. So they made the decision on day 35 to end the recount, which ended up determining the Bush presidency. So we would expect to know probably by the 8th. If not, then some states can think they can do what they want, and it gets into a very messy situation very quickly. So it's 2020. Let's not get there or talk about it. But we're happy to answer any questions around the Electoral College and how that could play out if they miss the 8th or the 14th. On December 31st, we've got a number of expiring tax provisions. There's a couple of COVID provisions that expire as well related to unemployment insurance and the PPP program that need to be extended, or at least some members of Congress want to extend. We would expect this to wrap up, though, probably the week before the week of Christmas. So that Congress would probably be home before the 31st. If you want to go to the next slide. So then that takes us into the new year. Congress convenes on the 4th. The Georgia runoff is the 5th, barring anything unforeseen that would determine control of the Senate. On the 6th, you'd have a joint session of Congress to count the electoral votes and actually certify the results as to the next president. And then on January 20th, we'd have the presidential inauguration. Again, we are assuming that would be, absent an extraordinary situation, would probably be Vice President Biden and a Republican Senate. So you can go to the next slide. That's the federal look. We wanted to quickly go over some state issues and turn that over to JP.
Yeah, just very briefly, as we look at where we stand, from a governor's standpoint, all the incumbents won the re-election. New Hampshire and Montana elected Republican governors, so there's a shift in Montana. Only 10 states have divided government, so by and large, what we're seeing is democratically dominated states or Republican dominated states. And by that, we mean when it's divided, there's at least one chamber or the governorship that differs from each other. So if we go to just the legislature, 48 of the states so far, and we expect Arizona to be the 49th state that have unified legislatures as far as the party goes. The only one of the few exceptions is Nebraska unicameral. Would not count. Minnesota is one where there's still divided legislative split, and that's it. Interestingly, I think one of the quick points, I think it is the least legislative change in houses since at least 1928. There were 3 chambers that switched: the New Hampshire House and Senate, and then arguably the Alaska House, which is nominally controlled by the Republicans, but in reality, a coalition of some Republicans, some Democrats, and independents have controlled it. And now Republicans look like they're slated to take over the legislature. I would also note that from an insurance commissioner standpoint, for those that are interested, All the incumbents won. Trinidad Navarro won in Delaware. Wayne Goodwin and Mike Causey went, Wayne Goodwin being the former commissioner, Mike Causey, who actually wore a wire during the early in his administration to deal with a fraudulent, people have gotten convicted, a situation where they were trying to bribe him to approve things. Won re-election. He is the first, Mike Causey is the first elected Republican commissioner in North Carolina. John Gottfried in North Dakota essentially ran unopposed. Mike Kryler won election. And then Troy Downing in Montana maintains the Republican legislature insurance commissioner / auditor there. As you recall, Matt Rosendale ran for Congress and successfully won. Next slide, please, Sloan. And from an issue standpoint, I think, the first and above all biggest issue is going to continue to be state budgets as we move into next year. States are looking at significantly devastated budgets in a number of cases. The dollars are not there. They saw both their tax revenues decline significantly, as well as their expenses through unemployment insurance rise significantly. Medicaid is expanding. My expectation is, as you've seen in previous crises, that you will be looking for easy wins that don't cost the state any money. That typically is an issue. I think Medicaid will be interesting to see what they do with Medicaid. There are some advantages, as Joel indicated, that perhaps the Biden administration could sweeten the pot and make it attractive for the money to come in and maybe move folks off some of the unemployment insurance pieces, and there may be some others. We expect that drug pricing issues are going to continue to be a big issue in the legislature, as they were this last session. Insulin in particular was a discussion about limiting the cost sharing in insulin. And in general, cost sharing of drugs, I think, are going to continue to be an issue. Opioid issues, as states start to catch up in legislation with other states have passed, we expect to continue to move on. I think ACA issues will be interesting. We'll have to see where the Biden administration goes with 1332 waivers. I think there were a number of states that we're looking at the potential spread of costs between what's the so-called federal platform on a state-based exchange versus a federal exchange, where you've got about a 0.5 point spread between those two fees that are attached to the exchange, and the state could run the exchange on the federal platform, use that 0.5% collected from the insurers to help fund reinsurance programs, similar to what Pennsylvania did this last year. So we'll see if there's increased interest in that. The Democrats certainly pushed that through legislation. There may be some interest in taking more control, a sense of even Republicans taking more control over there. So I think that's something to watch. I think also watching what happens in the Supreme Court will be interesting, and how it potentially impacts the issues broadly and who it applies to, depending on how they rule. Transparency, I think, there's going to be increasing interest in consumers understanding what things cost. We saw that in our efforts in North Dakota. And again, we can get you a copy of the report if you're interested. And it's not final. We'll have a final version of that report in January. But I think you're seeing hospital prices and others across the board be an interest, with some really good players in a number of areas, and some not so good players in other areas. And lastly, I think pharmacy issues are going to continue to be at the top of state agendas. Again, this falls within their ability to take interest, legislators to take interest in something that doesn't cost them any money and is something that is of interest locally. The local pharmacists have had some concerns with pharmacy benefit managers broadly, and are looking at increasing regulation. I'd note that the NEIC recently passed a new licensure model that may be of interest to some states. So we'll be watching those. Last thing I would note is short-term limited duration coverage, as well as accepted benefits appear to be on the chopping block, both federally and locally. There have been efforts on short-term. Obviously, the Trump administration expanded the short-term plans and their ability to go, but they're still fundamentally controlled by the states. There have been an effort to attack some of the accepted benefits plans. Now, these are plans that typically provide supplemental benefits to insurance. In a lot of cases, help consumers pay for things like cost sharing, copays, in sometimes for specific diseases like dread diseases like cancer. We expect those are going to be a broad discussion. So HBI will be continuing to push, especially in the accepted benefit plan pieces, those issues in the states and understanding of the value that they provide to consumers. And happy to answer any questions at the end if you've got any questions on what's going on in the states, but want to do a quick overview. Next slide.
Thanks, JP. I know we've got a question about Medicare Advantage. The question, I think, was, what are some of the threats? Well, let me read it again. Key regulatory risk changes and opportunities for Medicare Advantage plans. I think, at a big level, if the public option had any legs, like if the Democrats took the Senate, they ended the filibuster, they got public option, they had some kind of a Medicare Advantage kind of buy-in or Medicare buy-in that came with some price controls, right? We're limiting rates to no more than fee for service or less in the MA program would be a risk. I would point out that there's major solvency issues for Medicare that are probably in the next, right now, projected to be in 4 years, but probably closer to 3. So I think, Medicare Advantage is always kind of on the chopping block for budget cuts, particularly from a Democratic perspective. They were in the ACA, a big funder of that. Risk adjustment still needs some adjustment and some work, and that's probably on the regulatory side. I think we've seen a huge uptick in telehealth during the pandemic, and I don't think they have the risk adjustment calibrated for some of the telehealth issues, and so we would expect to see that through the regulatory process. The Trump administration just put out a deal on transparency that required the MA and other insurance plans to basically provide access to their data, proprietary data. And I think that, sorry about that. One of the challenges there is that I think the Biden people like it, and I could see how they could broker some kind of a deal with the MA plans to get that off the table. And then I would say the one of the things that we've seen in Medicare over the last couple of years under Trump is they've really given a lot of tools to the plans, whether it's DUR or prospective or retrospective risk adjustment, or some of the step therapy changes that they've authorized the MA plans to take. Some people would argue from a Democratic perspective that that's anti-patient, and they could, move to regulatorily rescind those in the Part C and Part D programs. So those are kind of at risk. If you're an MA plan, I would be paying attention to those things.
Yeah, I would just note that there's always, Joel, that tension between MA and traditional Medicare, and the Medicare supplement really more than any others. And so I think there's always that sort of tension potentially to look through. But on the flip side of that, I would say that there'll be some significant issues if MA goes away for the supplemental carriers picking up those individuals from a cost perspective and the expectations. So I think that chaos is potentially problematic and for patients. And so it's something that we need to watch closely for a lot of reasons.
The other interesting trend that we're seeing is for some of the think tanks, Third Way, Brookings, and others, they've actually proposed ending fee-for-service. And that doesn't mean just having Medicare Advantage, but it means more value-based reimbursement in the fee-for-service world. So like not paying based on volume, paying based on capitation or risk or partial risk or some other outcomes based type measure. I think in a world like that, it's really hard for physicians and others to organize in ways that kind of beat on an efficiency basis Medicare Advantage plans. And so, I think if that happens, and we're not expecting it to happen, but I think if that's a movement over the next, say, 5 years, that really advantages a Medicare Advantage space, in my opinion. So, we've got about a third of enrollees in MA right now. I think, more and more people, the baby boomers, are choosing Medicare Advantage overwhelmingly from fee for service. It's where consumers want to go. I think, we had some challenges with open enrollment too, in presenting accurate information across, different websites and things like that. But, in general, I think it's a very positive outlook for Medicare Advantage. The other open question, I guess, would be international reference pricing, and could that bleed through to Medicare Advantage? Could they either piggyback on the costs there and take advantage of it, or would that hurt them, by bleeding through? So by getting a cost shift basically onto them. So those are some of the issues that I would see. Other questions, Sloan?
None that I'm seeing. Just to kind of close up administratively, the slides and the recording of this webinar will be posted to the Horizon website sometime this afternoon. It's horizondc.com. And you should have my email in your invite. So if you have any questions, just feel free to reach out or contact Allie on this screen.
And on those lines, I would say if you want access to the database we've constructed on potential Biden administration officials, if you're a client, you'll get that. If you're not, get in touch with us and we'll talk about it. I would say that, our team, we've constructed a great team here. Greg Johnson is one of the best political minds in the business, I think. JP is a former insurance commissioner. Knows the states intimately well. Brett's a senior Senate legislative staffer who's put together several laws that are all going to be kind of hitting next year. Jeff Lemieux, former CBO staff, who constructs our proprietary economic and fiscal impact modeling. Sloan, Amanda, Jen, incredible skills on the Hill and organizing our coalition efforts. Just really an amazing team, and I've managed a lot of people over 12 years on the Hill and doing this for a while. We're here to help you make a difference and to impact healthcare for the better. So we're looking forward to an interesting lame duck and an interesting 2021. I'll tell you that. Hopefully it'll be a good interesting, not like some of the issues in 2020 that we've experienced. So with that, I really appreciate you guys joining us today, and for everyone's time. Be in touch and stay safe. Thanks.